Hi, this is Dr. Sasse from Sasse Surgical. I'm going to talk a little bit about sleep apnea treatments and what we've learned in some recent research. If you hang in there till the end of this video, I'm going to tell you 3 things that you can do to resolve your sleep apnea and have the safest, best, most excellent outcome afterward. So first of all, what the heck is sleep apnea? If you're watching this, you probably already know this is a problem where we get obstruction in the airways, and during sleep we snore at some level, but then we stop breathing too, and that's the pauses, or the so-called apnea, where we actually don't breathe for too many seconds, which becomes alarming to our spouse who's elbowing us to take that next breath. And it leads to problems because we're not getting rid of the CO2 in our lungs. We may be oxygenating enough, but the CO2 builds up in our body. And it leads to problems, including things like heart arrhythmias and, over time, very serious problems with our heart and our lungs. So it's a serious problem. Not to mention it makes us tired during the day. We're not getting good sleep. People have headaches, they have drowsiness, they fall asleep at the wheel and get in car accidents. There's a lot to be said about sleep apnea, and so it's very important to diagnose it and treat it. Most of sleep apnea in this country and around the world is due to excess weight, but not all of it. There's a fraction of young, skinny people who get sleep apnea. But mostly it's nowadays due to excess weight. So as we gain weight, we think that the soft tissues get a little bit more fat in them and a little bit more tissue obstructing our airways. And so this is the mechanism. So the things that we have to do, of course, first are to recognize it and go ahead and get a doctor to help diagnose it. Yes, it's a bit of a pain in the neck and you have to get a sleep study. There's home sleep studies that can be done initially, but then there's the in-lab sleep study, which is sort of the gold standard. We're trying to chip away at that to try to gain enough information with the simple home sleep studies, and we've made some progress with that. You can often gain enough data to at least tell the person, yes, you do have the diagnosis and you do need to get treatment. Of course, the initial treatment is to use a device, so the CPAP mask or the nasal CPAP or BiPAP give that positive pressure that helps us with that ventilation during our sleep, and that can be a great treatment. There's also some success with some oral devices, and I'll address some of these more in other videos. Lastly, there is losing weight. So if the sleep apnea is in a person who is overweight or obese, then losing weight, of course, is a very effective treatment, and arguably it's the most effective treatment. Here's one of the most fascinating things about it. In people who are overweight or obese, many of them try like crazy to lose weight with diet and exercise and pills and so forth, and they get nowhere, and they turn to bariatric surgery or metabolic surgery. The most curious thing is that metabolic surgery, with the sleeve gastrectomy in particular, but with all of them, cause not just weight loss through restrictive mechanisms, but it's really the hormonal changes of the surgery itself. And that is what drives a change in metabolism and a change in body weight, so-called reset to a new set point of body weight. That's why they're so effective, so much more effective than they really should be by what's actually taking place. So the least invasive procedure, which is safer than an appendectomy and very, very safe in skilled hands around the world, is the sleeve gastrectomy procedure. And here's this interesting nugget. In scientific studies today and in studies involving animals and humans, that change in hormones that takes place with the sleeve gastrectomy, it reverses sleep apnea, not just because people lose weight, but it starts to happen immediately because of the hormonal changes. So we see that after sleep gastrectomy, people start resolving their sleep apnea immediately, before they've really even lost weight. And this has to do with the central acting mechanisms of the hormonal changes from changing the hormones in the stomach. In the future, we're going to have better and better medicines that take advantage of this new metabolic and hormonal biochemistry research that's coming out. But suffice it to say that it's yet another reason to consider metabolic surgery as a primary treatment for sleep apnea because of its safety record, simplicity, and now effectiveness through multiple medications. So what were those 3 things that I said that you could do to sort of address this problem and take risk out of your life, reduce your risk of the heart trouble, reduce the risk of the sleepiness, auto accidents, headaches, and all the problems associated with sleep apnea? Number 1 is ask your partner, ask people if you do snore, and if you think that you might have this problem, be honest with yourself and recognize that if you do, it's nothing terrible, but you need to acknowledge it and need to look into it. Second is to seek out a provider who can order that test and really nail down the diagnosis. Do I truly have sleep apnea, and how severe is it? They'll grade it on a level of severity. And the third is to examine your own height, weight, and BMI. If your BMI is over 30 or certainly over 35 and you do have obstructive sleep apnea, take a hard look at metabolic surgery as a treatment, because it may be the most effective and oddly it may be the safest and least invasive treatment for a problem that is otherwise pretty serious. So you may find that metabolic surgery actually reduces your risks for all sorts of health problems in life, as the studies show. And so give that some consideration. It may sound kooky at first, but once you look into it, you may find that it's not so much. So those are my 3 bits of advice. I wish you great success in resolving your sleep apnea, and I wish you great health overall.